All right. So I would like to introduce Dr. Hamas, and just kind of, I got a little blurb here. She gave me a bio, but a lot of what she's probably going to be talking about is in that bio as well, based on some of my questions that I have for her. So I don't want to read the whole thing, but I do want to just introduce her. Dr. Hamas is an internal medicine and lifestyle medicine doctor, certified by the American Board of Internal Medicine and the American Board of Lifestyle Medicine. She obtained her internal medicine training at the University of Illinois in Urbana-Champaign in 2013 and was the primary care physician there until 2019. Her husband, Roel, is also a physician, and they have a 13-year-old twin boys, Ashton and Aaron. The family moved to Arizona in 2019, July, and she started her lifestyle medicine practice, I think it was at that time then. So first and foremost, welcome, Dr. Hamas. How are you doing?
Hi, Mike. Good evening, everyone. Thank you for being here. I'm doing well. We're 99 degrees Fahrenheit here.
Oh my goodness.
So.
Goodness gracious. Well, if it's okay with everybody, what I'd like to do is I honestly just have a few questions for Dr. Hamas, and I have a few more to add if nobody here has any questions for her. So why don't we just have me and her have this conversation for a little bit? We can just put everybody on mute. And then in a little bit, I'll just open it up for any questions you guys have. A number of you have said, oh, I want to ask her about this, or I want to ask her about that. So we'll certainly have that opportunity, but just to cut back the background noise and such, if I can get everybody to mute your phones, that would be wonderful. Is that cool? All right, I appreciate that. Okay, so I know a little bit about this. We actually haven't talked for a little bit. We've been going back and forth with texts from time to time, but I do know a little bit about this but there's a lot here that I'd like to dig in with about your own personal journey, about how you came to lifestyle medicine, et cetera. Could you just kind of let us know what happened with you as a physician and what rolled on for you to be interested in this lifestyle medicine?
Yeah, let me start by laying the kind of like the background of my family. I was about 8 years old when my mom was diagnosed with type 2 diabetes. It only took 2 years before her doctor added an insulin into her three oral diabetes regimen medications. At that time, it quickly progressed, and she suffered several complications: severe neuropathy, blurred vision, recurrent infection, depression, and many more. I was in medical school then. I saw her life surviving with diabetes, on top of hypertension, high cholesterol, obesity, asthma. So the list went on and on.
Yeah.
I told myself I would never, ever become diabetic. I'm going to do everything in my power. So I thought I was careful. Turned out I was wrong. Clearly, about 5 years ago, my A1C hit 6.5.
Okay.
And it's been crippling, from 5.7 to 5.9, 6.1, and then 6.5 through the years. I was monitoring that for every 6 months. And so that was 5 years ago, hit 6.5. And that time I was overweight. I also had this 15 years of gastric bloating. I don't know. I could not identify the triggers. Sinus allergy on nasal spray. But at the same time, my husband also was building his own list of chronic health issues.
Gotcha.
Pre-diabetic, obese, fatty liver, asthma, gouty arthritis, and he had to start on medication immediately. Hypertension, high cholesterol hitting 250s, and triglycerides almost 300.
Wow.
sleep apnea on CPAP, and all this. We're just 37 years old then.
Yeah.
So we both of us felt so frustrated and scared, and it was a mix of feelings because can imagine both of us are internal medicine doctors and primary care physicians, and our list of health issues are much longer than our 50s, 60-year-old patients.
Right.
So well, we made serious changes to our diet and practice everything that we know in medicine except medication.
Mhm.
But he had to start on gout medicine because the pain was so intense, like really crippling him. And we did that, but it didn't help.
Mhm.
And like everyone else, we felt the guilt of sedentary lifestyle because we're just sitting in the clinic, stand up when we go to the next room.
Yeah.
So we exercised. We had to wake up an hour earlier, so around 4 o'clock in the morning to hit on the elliptical, taking turns. So doing our part of the exercise, we kind of started on. We tried the portion control, food portion control, a little bit of everything principle, and it didn't help.
Gotcha.
We know it didn't help because we're monitoring much more close for our labs every 3 months, and the numbers just kept rising.
Gotcha.
So we were both doctors, and you'd think we're supposed to have the answers. We're supposed to know what to do, right? But the truth is we didn't know what to do because we didn't understand what's happening.
Right.
And though we did not understand what's happening, I know we both know that there are 3 things we're certain. And number 1, it's only going to get worse.
Yeah.
Number 2, we don't want to be on medications because we know the drill. 1, the next 2, the next 3, the next 4, the next morning you wake up, you're on 5, 10 medications.
Yeah.
And third is my mother is not at fault with me being diabetic. So those 3 things I was certain. Luckily, one night we stumbled on a documentary on Netflix, Forks Over Knives.
Mhm.
And then we realized there are many other documentaries there that talked about reversal of chronic disease with whole plant-based diet. And just around 15 minutes into the documentary, the bulbs lighted up.
Yeah.
We were so intrigued, as if we found something so so important.
Yeah.
So we never heard that in medical school or in medical training. And at first we had doubts. We had to kind of wrestle our minds into, really, is this true? I mean, how come, we never heard in 10 years of education.
Of course.
But what we did is instead of letting the doubt, tank in, we countered that with diving in far more deeper into the evidence.
Yeah.
That brought us to attending international plant-based conferences and self-education.
Yeah.
And that kind of really nudged me into taking the board certification. It was also all too personal for me.
Definitely.
So and that's why I took the boards and then applied right away what we know.
Yeah.
And in that, we dragged our 8-year-old twin boys. They were 8-year-olds then.
Okay.
Realize, okay, if we're diabetic at 37, this kid's exposed much earlier to this foods, to this unhealthy lifestyle. I'm not going to be surprised that they'll become diabetic in their teens.
Right.
So we decided, let's drag the kids with us. Let's together dive in, and we never looked back. In that journey, we just weeks into the change, we started to feel the energy coming back, the weights coming off. and then the medications, off too.
That's so
Um,
funny.
and then 3 months later, we checked our blood tests,
Everyone see.
and the results were just amazing. Where we're like, I remember that day, morning, we saw our results online. We felt like kids in Christmas morn.
Absolutely.
We were jumping and like, oh my gosh. So our A1C is normalized. My husband's uric acid normalized, and he lost about 40 pounds effortlessly. I lost about 17 pounds.
Mhm.
And we're back to our normal weight, like weights when we were still in high school.
Right.
And I was seeing my husband like, okay, this is how you look when you're in high school. We met at college, so it was like like stepping into the past, but the
Yeah.
beautiful past. And my rhinitis subsided, his rhinitis subsided too. And my kids, I was very vigilant in what changes are happening in their bodies too. So they used to have morning sniffles and then recurrent infections. Maybe, I would not say recurrent, but maybe no less than 3 rounds of antibiotic a year. But since it changed, I can no longer remember when the last time they had a fever.
Wow.
Those went away. So I told my mother about all this because she's diabetic, and she said, oh, I'm too late. I'm already on, it's just, it won't happen to me. But lo and behold, he was doing it secretly. She's in the Philippines. We're just talking over the phone. But then, I didn't know that she was also kind of dabbling into it, but she had to call me when her blood sugar tanked down. I said, what am I going to do with my medicine? So
Wow.
that's when I learned she's also doing it. And from then on, I took charge of her health. We're able to cut her medicines down from a total of 12 prescription medications to now 3.
Oh, wow.
Half the doses for all these 3. So yeah, and that includes the off insulin, and the all the inhalers were off too.
Wow.
From asthma. Not anymore in cholesterol medicine, antacids, osteoporosis pill, not anymore in that. So she's very happy. She's 72 years old, and she has lost significant amount of weight, feels younger and more energetic than ever.
Oh, that's fantastic. Wow, that's so inspiring. What would you say is the length amount of time since you saw Forks Over Knives until you were like on cruise control, where you're like, okay, we have the system down, we got the results we want, and now it's just a matter of fine tuning? Because obviously initially changing those behaviors takes some time.
So from the first documentary, that first night, my husband and I decided, okay, let's watch one documentary every night.
Okay.
And we did that, put the kids to bed early, watch that. On the third night, it's like, oh, this is a no-brainer. It now all makes so much sense.
Right.
How many more documentaries do we have to watch?
Wow.
So I started planning out our roadmap.
Okay.
And eliminating one thing after the other. It was, I would say, we're all in whole food plant-based in about a month.
Okay.
Fish was the last.
Okay.
But
Yeah.
You had to give up.
Yeah. Wow. And one of the other questions I have for you is, in the lifestyle of, like, we're probably everybody on this call, even the retired people, are really busy, right? And one thing potentially that this lifestyle brings is you can't necessarily just go through a drive-through and get this, not usually, get a healthy meal. There needs to be some form of organization or prep work. What would be a recommendation that you would say that's worked for you, or that your patients maybe have come to you to say, hey, this is something I did that really helped me with time or organization or on the go. I'm very busy in my life, and this one thing that I do really helps and supports me to have this food ready for me when I'm hungry. What comes to mind for you?
To me, it's very important to first identify what's your priority.
Okay.
Comes down to priority. What you're spending more time on is obviously the priority. Yeah, your
Mhm.
life's priority.
Right.
So I think the struggle of finding the time is not because the lifestyle change is difficult to fit into our current, um, you know, hustle of
Mhm.
day-to-day activity, but because we're not so certain, there's no clarity of what the uh, important or the first outcome we want to
Yeah.
achieve. So for us in our family, my husband and I were then full-time primary care, and I said, well, based on my research, and I didn't have a coach yet. I didn't have a coach. So I
Right.
had to start everything from ground zero. And part during my research, I quickly learned that it's gonna take up time, not because it's a time demanding lifestyle, but because I've been in this world for 37 years, and just that old lifestyle is
Mhm.
not, I'm starting off from, standing up before I can walk and run. So of course it's
Right.
going to take time. So we had an honest discussion,
Mhm.
really like, okay, so what's our priority right now, the family? And we both agreed, health,
Yeah.
I said, okay, then it requires us to step back, evaluate our time. How are we spending this time?
Mhm.
So I had to cut back my working hours. And that's one thing that's very important, because you're going to end up with frustration piling up, one on top of the other. When you're hungry so much that you would not care what to eat anymore. It's just what's available.
Right.
But as you said, the prep, the planning
Mhm.
comes in there, and what you put time into, your heart into, being able to, you have to find that that understanding by heart, that for you to acquire something, you got to give up something. And
Right.
what is that? And everybody's different. And maybe not giving up, but modifying it depends
Mhm.
on your current lifestyle. But that's the important piece that I've learned. And even so, when I'm coaching my patients, and the busy lifestyle is at the forefront, I said, okay, we need to address this one.
Yeah.
Because everything else is not going to impact at all, at the level you want it.
Yeah.
When it's at the bottom of your list.
Right. Yeah, I love that. It's like a paradigm shift. You have priorities in your life, and when you have those in the order that you feel is appropriate for you, typically health is towards the top of that list. Well, then what are we going to do to make sure we have the mindset that we're going to make that a priority versus what we typically have done in the past, which is to go through the drive-through, let's just get it done quickly, let's not worry about it, et cetera. So I haven't actually heard it docked about in that way, but I love that response is just making sure you have that clarity of what your priorities are. And from that standpoint, then you can really make some good decisions that really help and support you for what the priorities in your life is, your health. So, wow, that's incredibly important, and that's incredibly helpful. I wanted to ask you a question just about, I know you've worked with patients and clients, and you have some pretty remarkable results that you've been able to work with them to find for themselves. What maybe stands out to you is just one example of working with a patient where just some coaching from the doctor and some support and encouragement and information, they were able to make some changes in their lives, and their outcomes were pretty substantial.
I'm sorry, can you repeat
Well,
the
just
question?
tell me a result that you're just so happy with one of your patients, basically.
Oh, result. Okay.
Yeah.
There's as many that I can say, but it's when I was a primary care,
Mhm.
most of my patient, because I infused lifestyle medicine to when I was still a primary care, and boy, that was challenging.
I'm
But I'm
sure.
proud to say that I was able to gather about 15 of them, all successful lifestyle changers, and most were diabetics and off insulin. And I have a guy with a 9.5, 9.8, 9 plus something A1C. And in
Sure.
4 months, we got that down to 5.4, off 84 units of insulin in just 5 days into the change. And then on top of that, he's got off all 5 blood pressure and heart medications, and off the depression meds, and losing weight. And like that was his name is Phil. It's in the testimonial of my website. I also have a guy, Roel, who was a severe coronary artery disease and has done several heart procedures, and this time he's not a candidate anymore. There's nothing they can do surgically, and so he was referred to hospice. So this is a hospice patient, and he turned his life around. And and his name is Roel. You can find that testimonial. I call him my Mr. Bravo, because he sent me a picture of that, with big guns in his arms. And for me, he was not on a lot of medications to start, but that turnaround with his life is just it's just so amazing. Currently, I have a mix of several patients, from history of colon cancer to autoimmune disease bonds to mental health disorder, and it's unbelievable how these people who said, if I can manage my my mental health without medication, my anxiety, my depression, I'm going to do everything in my power. That's the kind of patients that can actually become healers of their own body, and I'm just the director, but they're the actor.
Highly motivated. That's incredible. Very cool. Very cool. So I've got one here, and then I'm going to open it up to, there's a lot of people on the call that have a number of questions for you. What would you say with regards to, and I have this with a number of my clients, the spouse who is not interested in pursuing or changing their own eating habits? What would you do as a coach or as a doctor to help and support that patient that really is interested in making some changes, but has that spouse that just, it's a loving relationship. There really truly is love there, and there's care there, but they're just not interested and are not buying in. In fact, some of them are interested in keto and some of the opposite areas. What would you say to that patient who's maybe struggling with that piece? And then I'm going to open it up to everybody on the call.
I would have a deeper evaluation of what her beliefs are.
Okay.
A lot of times, they speak things, but these are just so superficial, that I believe in plant-based, but at the back of their mind, they're still pulled back with their own limiting beliefs like, I cannot do this without my spouse's help. Right. Or maybe, he's the cook. He's been the cook in our married life. Right. And I'm a working, wife, and how can I transition? So it's more of, I think the problem rests on the person seeing very little of his or her capacity, so that he or she tends to cling on to the old belief that she's got to have somebody to help her reach her goal, when in reality, that's not truly the case. I've seen that in one of my patients. The husband who's supposed to be terminally ill and didn't know about cooking at all, because she said, Edelita, we've been married for 55 years. You understand that?
Right.
And my wife, outright told me she can't go along with, but I want to do anything to live.
Yeah.
So I was that at that moment, Mike, I had all my limiting belief
Yeah.
that takes two to tango in this lifestyle change crushed, because this guy, he said, just tell me simply how I can prepare my food. And I said, are you sure about this? I asked him, and he said, of course. So I said, just boil water in the pot, throw in the vegetables that you can find, season it, and he actually literally did it, and didn't care about the taste, and because no knowledge at all in the kitchen,
Yeah.
right? But turn out he got stronger and stronger. The wife was got terminally ill for cancer diagnosis, and he outlived his wife.
Wow.
But the moral lesson of that story is that you can decide which direction you want to go. Right. And as long as you are equipped with, the hands, your feet, you've got eyes, you've got everything, all these necessary tools, you already have it. You just have to take the action and believe in yourself. Yeah. And a lot of times I see when you do that massive action, feeling you're all by yourself, but still doing it anyway, you become a beacon of hope, beacon of light in that family, and you start seeing them, starting to blend in to yours. So it just takes one person in the family to stand up for something.
Yeah, that's very powerful. That's very inspiring. And I love your words, limiting belief, because that's pretty much, as a health coach, myself included, we all have these, this is what reality is, and that's our own perception of that belief, right? And when we're open to the possibility, that's so great. And how you put that on yourself, to where it kind of crushed your own limiting belief as it relates to what this individual needed to have to get the fuel for his body. Very, very powerful. So I'd like to open it up. Most everybody is on mute. So if you have a question for Dr. Hamas, I would love her to, we have probably about 20 minutes or so left. I definitely want to just keep this under an hour, but so many of you have shared different questions with me that you'd like to ask her. So I'll just open it up and we'll just fire away. Who's first? Rose?
My husband and I are both registered nurses, and I work in a recovery area in an outpatient surgery center, and I have to do discharge instructions with my patients. And I try to really talk about how Mother Nature gives us back so much more when we eat what she provides than reaching for an over-the-counter stool softener or anything like that, And I'm sure that my colleagues are tired of hearing me do my little lecture, but I just have to, And when I had one case, and this is what I want to talk about a little bit, is that it seems that you are in the minority as far as you putting faith in your patient to be able to change. So many doctors, it seems like, don't think that the average Joe off of the street is going to be capable of changing. But I think it's just a matter of showing them that you believe in them, and then educating them and kind of like pulling the mud from their eyes, It's but I talked to an anesthesiologist about this, and I got that very same attitude, was, oh, they'll never change, they're too stuck in their habits. And I was like, so I just wanted to point out that I appreciate that you are one of the rare ones, and I'm glad that you have hope and faith in these people to change.
Yes, thank you so much. I feel the same way too. It just crushed my heart when when I, when patients are labeled for something that they even don't know their potential of redirecting their health, their life. And I think that that's a passion that I carry, happily on my shoulder, because it's a two-way. To me, my patients think that I'm doing them, the grace, but also giving them grace and the chance too. But I tell them, don't you know that with you showing me that you can do it, even more, fuel my faith that there's people out there like you, and I'm all out to look out for them. I'm out to look out for them. So when I see what I call miracles, because not very many people would believe in their own capacity to heal themselves. But if I can make them see that, and they're willing to walk with me, then definitely they're very worth my time, worth my effort, and worth all the craziness of the journey that we go through. I think that it should start with giving people that sense of word of hope. It's not that we're becoming melodramatic with this, but we have the science to back it up. And so why not put that at the forefront of healing?
Yeah.
Definitely.
Thank you.
And I have to agree with Rose, because I've been diabetic and I just have come off insulin finally, but they kept I know. But the thing is, it's really frustrating. It was not the doctors that did it. It was me and whole food plant-based and working with Mike. And she kept saying, after a year and a half, I'd been up to like 60 something units of insulin throughout the day. And then she kept bringing it down. And then finally, the last time I went in, she said, you know what, we're going to take you off the insulin. She said, I don't know what you've been doing for the last year and a half. And I'd been telling her what I'd been doing. And it's like, I shouldn't be the one telling you. You should be the one telling me, I mean, so it's really shocking to me that the doctors don't promote proper nutrition. I mean, that should be the number one thing in their toolbox, in my opinion. But anyway, so I really appreciate you doing what you do. In fact, I was wondering, do you do teledoc sessions or whatever?
Yes. I do. My practice is 99% virtual. So I even have a patient in Illinois, because I have an active license still in Illinois. I think she's from Illinois. So we've been, working for a couple of months now. And I love that, I'm still at least able to impact the state where I came from and lived longer.
So being from Illinois, I could work with you?
Yes. So virtual, I'm not on like this, well-known platforms. I do private practice, and everything is just virtual, and we're able to do that in a platform that is safe. And so I'll stay able to do whatever I'm doing here in Arizona. Even my Arizona patients, I just see them one time for first visit. So can we put a face in her name? But the rest that follows are virtual.
I didn't know there was a difference between virtual and teledoc. I thought that was like the same thing.
The teledoc is like a company.
It's a brand name.
Company.
Oh, okay. I did not realize that.
Mhm.
Okay.
So telehealth in general is the term.
Yeah. Yeah, and at the end, I'll definitely ask Dr. Hamas, and we can also put it in the description on the video and such, if anybody's interested in getting in touch with her, how that would be done, et cetera. So we'll have that at the end, so.
Now, I've got a couple other questions. I don't know if these are possible things that you can answer or not. My husband has had a horrible, horrible, horrible case of shingles for the last, actually, it's entering 9 months now. And there is nothing. He's been to his doctor, he's been to a neurologist, they've given him tons of drugs, he's on medical marijuana. There, he's trying to move more and do cold, hot showers, but there is nothing. Do you have anything at all? And he is whole food plant-based. I mean, but the doctors, it seems like there is really nothing for the nerve stuff.
So you're talking about the post-herpetic neuralgia pain, right? I don't have anything on top of my head at the moment, specifically for that, but I'd be happy to look at any data about it in my research.
We've been looking. I mean, we've been looking like crazy, and there's different ideas here and there, and he tries them, but it's like, I think it's just maybe one of those things he's got to just bear it out and keep trying to be healthy and, do what he needs to do. But anyway, and then another question. Now I'm still on lisinopril, and I don't know why they actually put me on lisinopril with my diabetes. It was because of some kind of protein or something. It's not because of blood pressure or anything like that. My blood pressure is good, but I don't really take it, and I don't feel like I need it. I don't know. I mean, it was like they did the range. I was like just above or whatever, below the range or whatever that was considered normal. And I'm thinking, can I just like taper off of that? Do you think maybe you tell me that?
Yeah, I mean, I have patients in that same situation too. But what I can tell you is monitor your, that urine microalbumin creatinine test. Get a series of every 3 months. That will pretty sure, decrease because the nephropathy is a complication of diabetes. So a lot of times, most of the time, the reversal of complication happens at the tail end.
Okay.
So if you think of the sequence, it was a disease, and then for so long creates the complication. Now you're reversing, the sugar is coming down, insulin is off, but the complication is still there, and it will take, a lot of times it takes some time for it to, for the kidneys to heal. But that is very, very possible. So even without the help, sorry?
I'm sorry, would that also be true like for UTIs?
Oh, UTI is a different entity.
I thought it was connected probably to my diabetes, but I didn't know for sure. Now,
the lisinopril is, if you don't have blood pressure issues, perhaps you're kept on the low dose lisinopril to protect the kidneys, but
exactly.
Why won't you need protection for the kidneys if you've already shut off the source of injury to the kidney, which is diabetes? But again, it will take time. So I'm seeing that with my patients too, where we give it some time, but the monitoring is there, should be done.
Very cool. All right, who else has questions for Dr. Hamas? Awesome stuff.
Oh, Mike.
Yes.
Yeah, I was wondering, what is her go-to snack that she eats here and there and what have you? What is her go-to snack? That's a simple question, but it's kind of interesting.
Great question.
One word: fruits. Fruits is my go-to snack. I also make some plant-based pastries. Got some brownies or cookies or cakes. I may make some fruit salad, but 90% of the time it's fresh fruits.
Awesome. I saw the video with you, with the other woman interviewing you, making the black bean brownies. That looks so good. With the dates, that was awesome.
Yes, we had fun.
You got to make that. That's awesome. Who's next?
Can you hear me?
Yes, ma'am.
Okay. Hi, Dr. Hamas. I'm Christina. I'm Mike's daughter.
Hi.
Hi. I just have a quick question. So I guess my question is about meal prep. Do you find, and sorry, I was about 10 minutes late to the meeting, so if you already said this, so sorry, but do you find that meal prepping, one day a week and then having kind of your meals set up for the rest of the week is kind of the best process for you and your family? Or do you find that you're kind of making fresh food and like cooking every single day?
I'd say that I kind of evolved through the years, depending on, because my kids are growing up and my work schedule has changed too. When I was in Illinois, I was still working primary care part-time, kids going to school, and I was prepping, I was cooking at least one meal advance. Now that the boys have grown, they eat quite a lot, and now that one extra meal is gone. Right now I'm improvising my strategy. Basically, I end up cooking just right maybe an hour before the meal. That's for dinner. For lunch, I'm able to tap on making a sandwich. I'm doing sandwich that are still filled with my greens, right? And making some dressing or making some hummus that's very filling. So maybe for lunch, easy to make, and the kids also make themselves to prepare the sandwiches too. But I pre-make the sandwich bread or the hummus, and it's in the refrigerator. Breakfast is easy because that's oatmeal, and my kids know how to prepare their oatmeal already. So I just have to pre-cut the fruits, so I know it's gonna kind of change too as our dynamics change, but for me, there's no box type rule or guide, that this is what's going to work 100% of the time, 90% of the time. You have to look at your schedule, your planner. What's my day gonna look like? If you have a constant, the same schedule throughout the week, then that's uniform. Then maybe the you call this the preparing on the weekend would fit for you.
Cool.
Awesome. That's really helpful. Thank you.
Welcome.
Who else has a question for Dr. Hamas?
This is sort of an awkward one. And I've lost a lot of weight, but I still have a lot of weight to lose. But of a lot of weight. I'm working out, I'm trying to do weights and stuff, not intensely, but more. But the loose skin and the wiggly jiggly flabby skin, it's like, is there anything, or is it just one of those wonderful trophies that we get to so much weight?
Well, I have that too. So hydrate, make sure you're well hydrated. hydration is very important. That saggy skin is just a natural way of telling you that that space was filled up a lot by fat before, and now the fat is dissipating, and of course the stretch skin is gonna result to wrinkled and saggy, and
Like cutting the skin off or no?
it depends on where it is located, right? So I would still resort to intensifying my my exercise into toning muscles right at that area where I have saggy skins, and be patient. Be patient. It depends on your age as well. So younger individuals may have bigger chance for their skin to tighten back, but older ones may have less chance because of the aging process too. So
what would you suggest, Dr. Hamas, for somebody that's interested in having a physician that's more of the plant slant, where they are open to, if you look in Central Illinois, which most of us are, and you look for plant-based doctors, it's not zero, but it's pretty low. I mean, you have to almost go to St. Louis or Peoria to have a lifestyle medicine physician or a plant-based doctor. What are your thoughts on what somebody that's interested in pursuing a doctor that understands and can support them in that capacity?
can you specify what kind of service?
So
Is
just
it
a general
primary care,
practitioner, just a general practitioner that believes in lifestyle medicine or that believes in plant-based eating. We talk a lot about the doctors, and there's been some comments about why don't physicians do X, Y, Z? And I think one of the reasons is, to Dr. Hamas's point, even just a few years ago, she was not educated in that capacity. So unfortunately, there's so many reasons why that happens. But for those individuals that are enlightened, that say, this is really something that I want to pursue, and I would love to have a physician that would support me with knowledge, information, healthcare, et cetera, that is more leaning towards plants or plant-based lifestyle. I kind of struggle myself with, am I going to drive to St. Louis? Maybe I will. I don't know necessarily. I don't have a plant-based doctor right now, but I feel like I'm okay with where I'm at health-wise, that I don't necessarily need to pursue that. Although I did go to St. Louis last year for a plant-based doctor for my back, which it hasn't bothered me for a year and a half. So I don't know if that was why, but I'll take it. So what are your thoughts on what a patient can do that's looking for a plant-based doctor, but in their local area, they can't find one?
No, please know that there are plant-based, there are doctors who are also silently advocating a plant-based, lifestyle. I know that because one of my patients, for example, she has heart issues, and she's a cardiologist, and we're working together, and her conditions improved. And so she was very happy when she came back to her doctor. I've lost this much weight and my medications have been tapered down. And what did you do? And she said, well, I have a coach. I'm starting a plant-based diet, months ago. And he said, well, that's good. And she knew, the doctor then said, like, yeah, I believe in plant-based. I'm vegetarian, on vegetarian at least, but, and so my patient came back to me and said, like, we've been together for 5 years and he didn't say anything.
Wow.
And if he had just told me that he believes in this, I would have jumped in, 5 years ago. And the same scenario with my patient who was colon cancer diagnosed 5 years ago. She went back to her oncologist, and her CEA, she's a tumor marker for colon cancer, went down significantly. And so she started telling her doctor about what she did. And the doctor said, like, yeah, and you know what? And then, kind of added more information on the account. It's like, where is this all coming from? You didn't say anything. So maybe when you have a doctor, you know, in the local area, I think it's going to be the other way around. You can't expect some doctors to start talking about it.
Yeah.
Maybe start a conversation like, what do you think about this, and kind of fish out something, because now I'm learning from my patients, their experience, like,
Mhm.
you know, they're not
Wow.
coming out like me, clearly what we believe in. And there's a lot of factors to that. Number one is, you know, the confidence that do I have all the education? Number two, you know, will my patient actually listen to me, or he's just expecting for another pill to be handed to him? You know, and third is the system that's very restricting. 15 minutes, 20 minutes, 15
Right.
minutes, you're late for 5 minutes. The doctor only has 5 minutes with you because another 5 minutes goes to roaming and getting the, so what can you talk about, right? So some
Yeah.
doctors will just shut their mouths off because otherwise they get boomerang with the, you know, delay in the time.
Yeah.
There are a lot of factors.
Yeah. Really, really good points. Yeah, definitely. Thank you. Thank you for that. So we have time for just one last question before we close it out. John, what you got?
Yeah, and this is kind of a deep topic, so I'm not expecting a huge answer, Dr. Hamas, but you know, I'm sure you've had patients come to you that have just a really unhealthy relationship with food. You know, food is really kind of has an addiction component to it, where they're using it as their best friend, as their comfort, as their numbing. You know, just like others use other substances and so on and so forth. So, how is there any sort of approach that you might use when you suspect that someone has just a really unhealthy attraction or attachment rather to food?
Yes, and that's what we in lifestyle medicine, and Mike knows that, is that we're trained to detect subtle signs of underlying addiction or dependence to this comfort foods. And when I noticed that in my patient, I would come out right away and say, we cannot be talking about what to eat, what not to eat, you know, sleeping time, changes, stress, blah, blah, blah. If you have this deep, unchecked, wrong relationship with food. So I dropped everything, all the, I kind of put the how-to on the back burner and put the why of why are you coming to me, right? And that, and I do that to put the patient on a, you know, in a space where he feels safe to tell me, you know, all the things that unfolded in the past that led him to this addiction, and in a way, me confirming my suspicion. So I do a lot of, you know, a lot, and a piece of cognitive behavioral therapy on the front end of the program, and make sure that we are kind of, you know, peeling those skin off so that me and my patient can look eye to eye. The thing that I find most helpful is when patients understand that this is a partnership. This is a partnership, and until we have our goals set clear enough for you to see and for me to, you know, also see, we cannot go any further, right? So there is an honesty. I do have ways to
Sure.
to get my patients to feel safe and not judged.
Well, and I love to hear that, because honesty and vulnerability, you know, are the pillars of recovery from any addiction, right? So I love the way that you frame that. Thank you so much.
You're welcome.
Well, that's our time tonight, but I'd like to say thank you so much, Dr. Hamas, for taking the time to answer my and all of our questions. If folks want to get in touch with you or follow you, what's maybe the best way they can do that?
Is to visit my website. It's
Okay.
www.theplan.edelita.com.
Okay, and I'll also put that in the description of this video so people can see that as well. So,
And in my website, feel free to, there's a chat button there at the right lower corner of the screen at the website. Put a chat if you have a message to me, or you also want to have a dedicated time. There's a free consultation button also in that page, and it will generate automatically a link for us to connect virtually.
That's
So I've got podcasts there, some articles, and feel free to visit that, and I hope that will add more information and knowledge in your toolbox.
well, this has been really helpful. And then also for everybody that, basically follows the WLS coaching group site, she often posts her podcast on that Facebook group site as well. And there's some really fantastic information there as well. So I love her podcasts. And I would highly recommend you listen to those as well. Just so much really valuable information. But thank you for the service that you're giving us and to your patients as well. Thank you so much.
You're welcome. I want to tell you though that my podcasts are not up to date
Okay.
because I kind of freeze it for now. But you do have all at least the
Wonderful.
basic pillars,
Yeah.
lifestyle medicine covered in those 30+ podcasts, because I'm working on an online course right now. So it's
Oh, that's
going
great.
to be released in September.
Oh, that's fantastic. Very good.
Okay.
All right, folks. Thank you so much. You guys take care. Thank you so much.
Thank you.
Thank you for having me, Mike.
You bet. My pleasure.